everyone, Michael Dudley with Cohort Intelligence. I have an awesome patient success story I want to share with you today that hopefully brings you some positivity going into this 3-day weekend. Today's story revolves around Laura. She's a care navigator here at Cohort Intelligence that's reaching out to John Doe. We're just going to use that name for PHI reasons on behalf of a primary care practice. Now, as a background on Cohort, we are hired by that primary care provider to be able to reach out to their patients, spend about 20 minutes with them over the phone every single month, be able to help manage their chronic illness. And from this perspective, hopefully keep them out of the hospital. Now, the way we do it is a little different. We use artificial intelligence, NLP technology to be able to help make these calls more efficient and more effective. But really, it all revolves around building a patient bond, one that is able to help make these lifestyle changes and keeps these patients out of the hospital. So that's a little bit about Cohort. Back to the story. Laura calls John. She's about 2 or 3 months into this program with John. John, at this point, had just built an initial bond with Laura, but really hadn't made a lot of changes in healthcare until this call. So John answers the phone and says, "Hey, I'm on top of things this month." And Laura was a little surprised. She said, "Yeah, last month I let you down. I felt like I was giving you a lot of no's. I didn't have my blood pressure readings. I didn't have all these things together. And so I made it an initiative to be able to be ready for this call. So when you called, I could not pick up this phone fast enough." He was so excited. He had his blood pressure reading, his blood sugar readings that he had written down every single day. He even had an appointment coming up that he was going to go to get his blood work that afternoon for, and also been keeping water intake every day, which you might know is pretty tedious. So from that perspective, John was on top of things that month, and he was so excited to share this with Laura. The reason I wanted to share this with you, I think from that perspective, physicians and everyone on the healthcare line is doing their best to be able to help these patients stay out of the hospital, but sometimes it takes a little bit more than that. It takes somebody that's going to be calling every single month to be able to follow up and give them. Sometimes it's advice on recipes. Sometimes it's giving them some education around their chronic illness. But ultimately, their goal is really to, after that bond is created, is to be able to provide and follow through on that care plan and help that patient stay out of the hospital. And it's so rewarding for these care navigators. So if you have medical experience, we'd love for you to potentially apply and be a part of our team. At the same point in time, if you have a primary care provider who might be interested, you feel like that they might have patients who could use some handling. What's great about our Cohort and the program that we utilize, it's completely paid for by Medicare, so it's no cost to the practice. So we'll love an introduction there, but ultimately we just thank you guys so much for being a part of this network and passing along our name. But enjoy your 3-day weekend. And enjoy the rest of your summer. I will be in touch.